COVID-19 cases continue to surge in the country. Gauteng is the epicentre, battling a third wave, while the Western Cape is bracing itself for the next spike. And with hospital admissions increasing by over 1,500 yesterday alone, there is concern over a shortage of beds. Let's discuss this now with infectious diseases specialist and Right to Care CEO Ian Sanne. Professor Sanne, the picture changes daily. What are things looking like currently in Gauteng with regard to COVID-19?
So in my view, we are very much in the epicenter of probably what should be called a disaster in terms of the numbers of patients coming forward for admission and ever-increasing rates of infections that are occurring. Gauteng in particular has been under enormous pressure since the closure of Charlotte Maxeke Academic Hospital, Johannesburg Academic Hospital, and with no line of sight from the province as to what decisions are going to be made on that facility. It is very unclear whether in fact the engineering assessments have been undertaken. It's unclear what the timeline is to make a decision on the facility, and therefore a decision as to how to replace the over 1,000 beds that are missing on the Johannesburg circuit. I think a really stringent response needs to come from the Department of Health to move this forward as quickly as possible. And they have a number of options. So the first of these options is to activate the field hospitals on which significant funding was spent, particularly the so-called ABT facility opposite Chris Hani Baragwanath. It is about a quarter full at this time. They need to activate and provide the staffing to that facility to ensure that it is in fact brought to scale. A similar facility has been built at George Macquarie Hospital just north of Tshwane, and indeed that facility needs to be activated as quickly as possible. And then there is a beautiful facility, not very large, but it serves the far, northeast of Gauteng in Bronkhorstspruit, which also needs to be activated urgently.
Professor, so a lack of beds is a dire concern. Let's also talk about healthcare workers themselves. The President highlighted a reduction in the numbers of infections among healthcare workers who have been vaccinated in his recent address. Are we seeing a reduction yet in infections amongst those over 65? And talk to us especially also about the morale, the health and the numbers of healthcare workers who are attending to the patients being hospitalized.
So indeed, Sisonke did in fact complete the vaccination of over 480,000 healthcare workers. We are seeing breakthrough infections amongst those that have been vaccinated. The spectrum appears to be mild infection, so the vaccine has worked, but it still places those healthcare workers out of the workplace. In terms of real numbers, we have seen a decline in reported healthcare worker infections on the per-cell system. That decline is a reduction of 90% from previous rates. And indeed, the President did announce this, and we can vouch for the fact that that is indeed the numbers that we're seeing. But overall, healthcare workers are very stretched, and they have been doing this for a good 15 months now, looking after patients with COVID. And one of the big differences is that we have not really stopped the rest of the health system's activities. In fact, in Gauteng, there was a desire to try and continue with surgery, which I think is elective surgery, which I think at this time would be a big mistake. Those wards need to now be converted back into COVID wards with urgency to ensure that we actually have the bed space available. The oxygen consumption rates, which is a very hard endpoint for Gauteng, have now reached and are exceeding the oxygen consumption rates for the second wave, which means that not only do we have patients in wards, but in fact we're only admitting those that are in desperate need of oxygen. That is the case in both private and public sector, and there are lots of messages going around looking for beds. So I find it remarkable that the provincial Joint Command Centre is, in my view, not visible. It appears to be missing in action, and we, in fact, are not seeing daily bed occupancy rates for each of the hospitals.
Professor, I want to jump in here because we're starting to run out of time, and I want to address something quite critical at this stage, a discussion point. At 2 o'clock this afternoon, we're hearing a briefing from Education Minister Angie Motshekga. There's a lot of speculation about whether closing schools would make any kind of real impact on a reduction in numbers. What is your feeling?
So this is always a two-edged sword because, in fact, we do need to try and continue with the education of our children. It is my experience that the schools are definitely a place where transmission occurs, and those children may in themselves be at little risk. But however, they take that infection home to their parents and grandparents. I do think in Gauteng we are reaching that point where we are rapidly moving towards the need for a lockdown 5. And I've said this a couple of times. People need to respect this lockdown 3 and start changing their practices and really getting back to social distancing. Otherwise, the health system is overwhelmed, and it is really reaching the situation where a lockdown 5 may be called for.